Joint Commission International (JCI) was established in 1994. Is an independent, not-profit organization, currently the leading organization in the world for quality accreditation and certification of medical services. JCI currently operates in more than 90 countries, brings together the world's leading experts in the field of healthcare, quality management, infection prevention and control, medicine safety, hospital management administration. With 8 sets of patient care standards, 6 hospitals management standards, the Joint Commission International Standard has become an important part of hospital management in many countries around the world. Currently, nearly 700 hospitals in over 100 countries around the world have been granted a JCI Gold Seal of Approval. To achieve JCI certification, hospitals must register to apply the anti-suitable JCI standard sets and at the same time must achieve quality in accordance with JCI evaluation criteria, about 1,200 criteria. Currently, Vietnam has 4 hospitals that meet JCI standards. According to Ms. Paula Wilson, President and General Director of the JCI, improving the quality up to international standards is what hospitals in Vietnam are aiming to take better care of patients.
The healthcare organizations that become JCI accredited are very special. You did not have to go on this important journey to improve the safety.
Hello and welcome to Sharing Vietnam on VTC10 Net Viet channel, and on today's show we will have a conversation with Ms. Paula Wilson, President and CEO of JCR and its International Division, JCI. Hello Ms. Paula Wilson, and thank you for joining us on the show today.
Thank you, Han. It's a pleasure to be here.
Could you share your review on the advantage and the drawback of the healthcare system in Vietnam?
So the Vietnam healthcare system, I think, is one that continues to grow and get stronger and get much more complex in a lot of ways, like many countries where the economy is growing. And there's usually a relationship between economic growth and the growth in the healthcare, both public and private. And usually when that happens, and this is a country that's growing in size, growing in economic strength, all kinds of good things happening. I was here 5 years ago in Ho Chi Minh City, and it has changed dramatically in 5 years. I was really shocked. I'm staying at the same hotel, and everything looks different. So and we know from the data that this is a country that grows stronger all the time. And that usually is accompanied by a change in the healthcare system itself. So more typically hospitals, and a growth in the level of service, as well as the ability for patients to access services. And all of that is usually an indicator for JCI's growth in a country. And so we've seen that here as well.
And how many hospital or medical centers in Vietnam accredited of JCI Gold Seal of Approval?
Right now we have 4, which is not a big number, but again, first time I was here we had 1. So we're very proud that we have increased the number of JCI hospitals recently.
And how they could pass the rigorous test to achieve the JCI Gold Seal of Approval, and how the re-evaluation be conducted.
So the number one requirement in our view, my view, is that there is a leadership team that believes that they want to improve the hospital from a quality and safety perspective. It starts with the leadership. The board, the CEO, the chief medical officer, those folks have to be committed and really drive the work that is necessary to become an accredited hospital. Reassessment standards and initial standards are the same. We have one book of standards. We publish them every 3 years, so we update them based on what's going on in medicine and healthcare. But it's the same book of standards in every country outside of the United States, and they are applied to each hospital equally, no matter who they are. First, and whether it's a first survey or the second time, 3 years later, the same standards are used. Now, one thing that would change at the second survey is that we would have expected a hospital to improve in certain ways that would be different than the first time. So that first time there's a baseline that is expected, but we expect everybody to get better every cycle, which is why the standards change every 3 years as well.
And is there anything else in Vietnam that made you impressed and interested?
This is an amazing country. It's physically beautiful. It's just a beautiful country with all of the lush vegetation you have and the wonderful food that you have, and a really, really impressive culture, one that I enjoy a lot. I'm proud to say I think this is my 5th visit to Vietnam in the last decade, and I've stayed on as a tourist in certain circumstances so I can see more of it.
And to be certified, how many criteria or standards that hospital or medical center are required to meet?
So we have standards in several areas. So the biggest program that we do is hospitals. And so we have a book of standards that applies to hospitals, but we also do ambulatory care. We do some long-term care. We do labs. Every 3 years, we go back and then, as I said, we'll expect them to have even gotten better. And complying with a new set of standards as well. But the method is essentially the same. We send a team of surveyors, and we have extremely highly skilled, highly experienced surveyors. That's one of the, our standards and our surveyors are really what make JCI. And so the people that we hire have had experience in healthcare. Many of them have been CEOs and CMOs, chief medical officers, chief nursing officers. And these are people who've worked for at least 20 some years. And now we train them how to be a surveyor. And they go in and talk and work with the staff to understand whether or not they're complying with the standards. And that method is the same, the first, the second, the third, it's the same. We don't change it based on how long the organization's been accredited.
The healthcare organizations that become JCI accredited are very special. You did not have to go.
Recently, Hạnh Phúc International Hospital has received a JCI Gold Seal of Approval, becoming one of 4 hospitals in Vietnam that meet JCI quality standards and is the first specialized obstetric pediatric hospital of Vietnam marked on JCI Global Map. To achieve this certification, Hạnh Phúc International Hospital must meet over 99% of the criteria out of 1,184 quality criteria from JCI.
It's a very big challenge for us. Once you got the gold seal, you have to maintain the standard. Maintaining a standard, you have to work hard. So what we are now planning, we are transforming all of our system into IT and technology so that the doctor, the nurses continuously monitor, system can pop up, the risks can be seen. So it's not like we are more dependent on the technology. So our measure, our clinical parameter, all we can get the data. When we got the data, we know where is the gap. And with that gap, we can improve quickly.
JCI standards focus on patient care, hospital management, and hospital quality management systems with a core spirit that is towards ensuring the safety of patients. The goal of this non-profit organization is to help patients benefit the most from the quality of Vietnamese and international healthcare systems.
Kể từ ngày mà chúng tôi được cấp chứng nhận JCI vào tháng 9 thì chúng tôi không có một cái cơ hội nào để có thể lơ là và không lơ là mất cái sứ mệnh của mình. Bằng chứng là cứ 6 tháng một lần từ ngày được cấp chứng nhận thì nhân viên chúng tôi phải cập nhật những cái số liệu thống kê về những cái chỉ số, những cái chỉ tiêu mà đạt được và chưa đạt được liên tục, kèm theo cái chương trình hành động để cải thiện những cái chỉ số đó nhằm mang đến cái chất lượng tốt nhất cho bệnh nhân.
The healthcare organizations that become JCI accredited are very special. You did not have to go on this important journey to improve the safety.
And there are only 4 private hospitals in Vietnam accredited with JCI Gold Seal approval. Do you feel that public hospital in Vietnam can achieve this certificate?
I think a hospital that wants to can be accredited by JCI. Sometimes it takes longer. We're finding that in some places, when we started out, 20 years ago we've been doing this. In the beginning, it was maybe 2 years, sometimes maybe a little longer to get ready to be accredited. Now there are hospitals that are taking even longer than that because they haven't been involved, they haven't had a serious effort at quality. As a nonprofit organization in the United States that works globally, the most important thing is being involved in getting better at quality. That's really what we want to do. And sometimes it may not lead to accreditation. We do a lot of education programs on quality management. We have a lot of resources around quality and safety, and they're meant for any hospital, whether they're going to get accredited or not. And we have some new tools coming out in 2020 where a hospital can do some self-assessments that may or may not lead to accreditation, but will lead to better quality. Our mission is to help organizations do better in safety and quality. One of our tools is accreditation. It's very well known and we're the best at doing that. But we have other tools for organizations as well. So public hospitals, and we have many public hospitals that are accredited, can be a part of this for sure.
And what are the values that Hạnh Phúc Hospital will receive after certified with JCI Gold Seal of approval?
Hạnh Phúc Hospital, where we were today, several. There's the Gold Seal stands for a hospital who made a special commitment. Again, and I always stress, they weren't required to do this. They're a good hospital. They were a good hospital. They will continue to be. But now they have a distinction, and they have said to the world, we put ourselves up for a harder test. So I think that helps them be distinctive in the market. But the other thing is really the patients that go there and the benefit that goes to them. Because hospitals that go through this have more success in terms of reducing infections, making fewer errors around medication. There are a lot of things that hospitals struggle with. And going through the accreditation process helps you do better on all of those types of tests and challenges.
And how about the benefits of the patients of Hạnh Phúc Hospital?
Sometimes, patients in our experience expect all hospitals to be really good all the time. And sometimes that doesn't always happen. And they shouldn't have to worry about that. That's really what a lot of this is about, that you should be able, as a patient anywhere, to go in a hospital and expect to be treated well and to be treated safely. So I don't know that I'd be curious to know if the patients at Hạnh Phúc Hospital today, they got a good dose of it because we had a big celebration. But in general, it's an interesting question if all the patients there or other hospitals are aware of JCI. Sometimes they are in some markets. In other markets, not so aware.
And which criteria or standards of Hạnh Phúc Hospital that impressed you the most during the initial survey?
So I'm not exactly sure. In the first survey, I think, in terms of where, from my perspective, the standards that are key are the leadership standards. We have a chapter called Leadership and Governance. There's an amazing team at Hạnh Phúc Hospital. There's a CEO, Miss An, who I met with, and was a pleasure to meet. I met many of the board members. And you can see that there's a team chemistry, a culture there that's very proactive, very positive, all of those things. But that comes from leadership. And so there is that chapter that we focus on leadership. So I would say, in terms of one that I would stress, it's that one.
So we had a great talk today, and once again, thank you for being on the show with us today.
Thanks so much, Han. I really enjoyed this conversation today. It's really one of the great parts of visiting your wonderful country. It's such a pleasure to be back in Vietnam. I'm looking forward to doing a little tourist and sightseeing in the next few days, and we'll return again soon because I think we're going to grow here, and we're very optimistic about this country.
So ladies and gentlemen, this is also the end of Sharing Vietnam today. Thank you for watching. Goodbye and see you next time.